What is depression? Depression, major depressive disorder, is a prevalent and critical medical condition that was a detrimental impact how you feel, think, and age. Thankfully, it is also curable. Sadness and or a loss interest is prevalent hobbies are symptoms of depression. It can impair your ability to perform at work and at home and cause of number of mental and physical issues.
Thank you, the presenter. Now I will continue the symptom of depression. So let's go to the point. Feeling sad or having a depressed mood, loss of interest or pleasure in activities one enjoy, changes in appetite, trouble sleeping or sleeping too much, loss of energy or increased fatigue. So that's all. Thank you.
Thank you, the presenter. Now I will continue the point of depression symptom. Increase in purposeless physical activity, feeling restless or guilty, difficulty thinking, concentrating or making decision, thought of death or suicide, persistent sad, anxious or empty mood, difficulty sleeping, early morning awakening or oversleeping. Okay, thank you.
Thank you for the presenter. Let's continue to the next point. Risk factors for depression. Depression can affect anyone, ever someone who seems to live a fairer, perfect life. Several factors can play a role in depression. Biochemistry. Different brain's chemicals may be a factor in the manifestations of depression. Thank you.
Thank you for the presenter. I will continue to the next point. The next point is genetic. A family history of depression may exist. For example, if such identical twin develops depression, there is a 70% probability that the other would also get the condition at some time during their lives. Next is personality. Depression seems to be more common among people who have low self-esteem, are easily stressed out, or are typically unhappy. Last point is environmental factors. Some people may be more susceptible to depression if they are frequently exposed to violence, neglect, abuse, or poverty. Thank you.
In treating depression, psychiatrists can do psychotherapy. Psychotherapy is sometimes used alone for treatment of depression. Psychotherapy may involve only the individual, but it can include the others. For example, family or couple therapy can help address issues within this close relationship. Group therapy brings people with similar illness together in a supportive environment and can assist the participants to learn how others cope in similar situations. Psychiatrists can give better antidepressant. Antidepressant may produce some improvement within the first week or two of use, yet full benefit may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, psychotherapists can alter the dose of the medication or add or substitute another antidepressant. In some situations, other psychotherapy medication may be helpful. It is important to let your doctor know if a medication does not work or if you experience side effects. Psychotherapists usually recommend that patients continue to take medication for 6 months after the symptoms have improved.
Thank you for the presentation. I will say about conclusion. The conclusion is that teenage depression has a significant impact on the future and has a number of negative consequences that can alter their outlook on life. As a community, we shall work to stop the development of depression by supply education pattern about its harmful impact. Thank you.